Good evening. Good evening and welcome again to Adelante Tucson, Tucson's new platform for political analysis. I am your host, Zaira Olivier.
And I am your co-host, Edward Cott.
In the light of the new proposed Healthcare Act, today we are going to focus on healthcare policy. To begin, on Monday, March the 6th, the House of Representatives, Republican leadership backed by President Trump, rolled out their plan to repeal and replace the Affordable Care Act. The Republicans were hoping to ram their bill, known as the American Healthcare Act, through Congress this month without an analysis of how many people would lose their insurance coverage or how much it would cost. So why their hurry and their need to keep drafts of the bill a secret? Because the so-called American Healthcare Act would cause millions of Americans to lose their health care insurance, while millions more would face higher insurance costs.
As a matter of fact, just yesterday, the Congressional Budget Office released its report on the proposed American Health Care Act, which estimated that 14 million Americans would lose health insurance the first year after the passage of this new Health Care Act. This number will rise to 24 million who would lose health insurance over the next 10 years. This will basically double the percentage working age adults who go without health insurance from 10% to 19%. This would save the federal government $200 billion, most of which will go to tax cuts that mainly benefit the rich. Over the 24 million people losing their health insurance, more than 14 million low-income Americans will lose their Medicaid coverage. This will have a special impact on the disabled, who make up more than 40% of Medicaid spending.
And equally outrageous, the repeal of the Affordable Care Act would provide a $600 billion tax cut for the wealthiest 2.5% of the population, while giving higher income households tax credits that are not currently available under the Affordable Care Act. This allocation of tax breaks from low-income households to the wealthiest American sectors will mark the largest transfer of wealth in American history. Under the Affordable Care Act, enrollment in Medicaid grew by almost 14 million people, reaching a total of more than 62 million in 2015. This increase would have been even bigger if 19 states, all with Republican leadership, had not blocked the Medicaid expansion in their states. The Republican-led American Health Care Act would cut back on Medicaid, first by cutting back federal aid to states who expanded Medicaid under Obama's Affordable Care Act, and then by converting Medicaid into a block grant for states.
Now, what is a grant block and why is it such a big deal? So far, the basic idea is that states would get fixed federal grants that would be based on the state and federal Medicaid spending in that state. The grant would grow slightly each year to account for inflation. However, the inflation adjustments are expected to be less than the medical inflation rate. Currently, states share the cost of Medicaid with the federal government, so poorer states pay less. The federal funding is open-ended, but in return, states must cover certain services and people. For instance, children, pregnant women who meet income criteria, and parents with dependent children. But under a block grant, states would have more freedom to decide who qualifies and for what services.
Now, how much freedom states will have will depend on the state government. Usually, states are given near unfettered flexibility. Many Republicans say that because states will have greater flexibility, they can innovate with their Medicaid programs. And we all know what innovation means to these people: less social services for the benefit of the rich minority. Further, lower-income households that make too much money to qualify for Medicaid would also lose their health insurance and end up paying much more. Under the Affordable Care Act, tax credits to help pay for private health insurance through the ACA exchanges are scaled by income, with lower-income households getting larger subsidies. Under the American Health Care Act, a refundable tax credit is only based on age, not income. Therefore, lower-income households would lose subsidies and would have to pay more to drop their health insurance, while higher-income households would gain a tax credit that was not available under Obama's Affordable Care Act.
So in addition, the Republican American Health Care Act would allow private health insurance companies to charge older people 5 times what they charge younger people, instead of the maximum 3 times under the Affordable Care Act. This will lead to more expensive health insurance for older Americans, especially those aged between 50 and 65 who are not eligible for Medicare. Some of these people will not be able to afford the higher premiums and be forced to drop their health insurance. But even seniors covered by Medicare will be put at risk, as one of the tax cuts under the American Health Care Act is a source of funding for Medicare. This will worsen Medicare's finances and open the door to cuts in Medicare in the future. The Republican American Health Care Act also does away with the employer mandate. For example, under the Affordable Care Act, larger businesses with more than 50 workers have to provide health insurance to their workers. In just the 10 years before the Affordable Care Act, 12 million workers and their family members lost employer health insurance as businesses cut costs to boost their profits. But under the Affordable Care Act, more than 8 million have regained health insurance from their jobs. The Republican American Health Care Act would lead to millions of workers losing their employer health insurance and either pay much more for private insurance or go without it.
Another problem is that the Republican repeal of the Affordable Care Act would cut $1 billion from public health programs aimed at epidemics, bioterrorism, and immunizations. These preventative efforts can and do save billions of dollars in healthcare costs and an unknown number of lives. Lastly, the American Health Care Act would also eliminate funding for Planned Parenthood. Currently, Planned Parenthood cannot get government funding for abortion services, which is a very small part of its overall program. But it is a major provider of healthcare services, especially to lower-income women without health insurance.
So with all that said, we'd like to discuss the novel concept of universal health care. 32 of the 33 developed nations have universal health care, with the U.S. being the lone exception. Universal health care should be understood as a fundamental human right. The right to access quality and affordable, whether preventive, wellness, or emergency services, is essential for any healthy and prosperous society. The United Nations Declaration of Human Rights recognizes the right to healthcare as a universal right for all people. The fact remains that the healthcare system in this country is entirely manipulated by the greedy for-profit interest of corporations and banks. This manipulation leads working and poor people directly into debt and bankruptcy, long-term health complications, and in some cases, even death.
We must then ask ourselves, why is the richest country in the world ranked last among 11 industrialized countries on measures of health system quality, efficiency, access to care, equity, and healthy lives? The U.S. was noted to have the highest costs while also displaying the lowest performance. In 2012, billing and insurance-related red tape cost the U.S. economy around $471 billion, and 80% of that was due to inefficiencies in our multi-payer system. A study from 2015 found that a single-payer system would save the U.S. $375 billion per year. Although a universal health care plan system is common sense policy, our government is more interested in debating tax breaks for the rich than actually serving the interests and social needs we all share as human beings.
So to finish it off today with a quote from Martin Luther King, which says, I quote, "We must begin the shift from a thing-oriented society to a person-oriented society. When machines and profit motives, and property rights are considered more important than people, the giant triplets of racism, materialism, and militarism are incapable of being conquered." Thank you for joining us. Thank you for watching, and see you next week.
Thank you.